nature and focus of some of her questions. I mean, this is a panel that has seen some of this material before in other contexts. So I would say the greatest optimism I drew from today was the shift in what I perceive to be their understanding of our position from the beginning of the day, from say 9:30 till 11:30, when we roughly 11:30 when we left the courtroom. So, but I long ago, as a litigator, learned that predicting based on what you see in the courtroom is a very dangerous game indeed, and so I'm a little bit loath to do that. What in this round is in our control is now done. We now wait, and when we see the result, either we will appeal or we know the federal government will either ask for en banc review or a Supreme Court appeal, and we will take it at that point again afresh, and we will digest thoroughly what they have to say, their perspective, especially if you're going to go en banc, because they're going to be almost a quarter of that panel if it's reviewed by the whole court. So those are things that we look forward to, and just within the next month, you're going to see the Sixth Circuit hear their case, St. Thomas More case, on June 1st. Our sister states, 26 of them, will be in Atlanta in the 11th Circuit on June 8th. They are there also with NFIB and some individuals, so there's a whole, and with 26 states, they have some who have laws like Virginia, and they have some that don't. So the array of standing discussion there can be much, much broader. And for reasons that I don't fully appreciate or necessarily agree with, the U.S. is being much more aggressive with the states on the question of standing, despite the Supreme Court precedent. Yes, ma'am.
You said there are better solutions to the issue of health care. What are some of them?
The question was about solutions in health care. Well, first of all, as a process matter, as a former legislator, I hope, first of all, I hope we prevail and knock this legislation out. And then I hope that congressmen, women, and legislators in states will start to take these in pieces rather than try to do one massive piece of legislation. There were so many simple errors made in this bill by doing it in this way that it's a sloppy way to legislate, in my view. I think that a better course is to pick one thing at a time and try and address it and improve that aspect of healthcare. And I'll give you one example, the last one I worked on in the state senate here, and that is, it is not known by many people, but it is illegal for a Virginian to buy a health insurance policy from North Carolina. You may say that doesn't make any sense, and I agree with you, but that's the law. I tried to undo that law, Virginia's piece of it, without success, because now North Carolina might be a bad example here, because of our border states, all of them have cheaper health insurance than Virginia, except North Carolina. And if you give our consumers, our citizens, 5 more states or 49 more states options to purchase from, you suddenly have much more competition for health insurance, and states have to compete too. The reason Virginia's more expensive is we keep piling mandates on, and that happens right here up the hill at the state capitol, when one bill a year comes in and they add a mandate here and add a mandate there. And yes, you cover more things, but it's the difference between broad coverage lots of people can afford or narrower coverage that less people can afford. And if we just had more competition on that point, frankly, we'd get both. But we would have more lower cost alternatives. That's one example that I've lived with myself. You are seeing discussions of tort reform on Capitol Hill going on right now. They can happen outside of the discussion related to this legislation because the cost in the medical arena is a secondary effect of our tort system in the states. In Virginia, we're pretty darn good in that area, and I hope they just don't mess it up from Washington. Yes, ma'am.
The judges didn't ask any about severability of the insurance mandate from the entire law. Did that surprise you, or is that discouraging to you?
I think that the way a judge likely reviews a case is they start from the front, standing, merits, then remedies, And as you saw through working through the discussion today, we were churning up standing and the merits and never got to the remedies. I think that the subject is pretty clean in some respects, in that either you knock the whole law out, you knock the private insurance, Medicaid, and Medicare pieces out, or you just knock the private insurance pieces out along with the individual mandate. And I say that because the federal government has conceded that without the individual mandate, the private insurance reforms cannot stand. So there's only a few slices of that that can be taken, and we just didn't get to that today in the course of time. For folks who don't practice law or litigate, the emphasis in these cases is on the briefs. I mean, when we go to oral argument, we are trying to address the areas that the judges have as areas of concern. And you know, Judge Wynn used phrases like, "I'm struggling with X." Those are the things that we then turn to address in our time at the lectern. Now, we only had 20 minutes. The judge extended us because they were asking questions, but there's only so much you can get to in that limited amount of time. So.
Can you talk a little bit more about the state law and sort of the balance of it gives you standing, but it wasn't passed to give you standing?
Sure. Virginia's Healthcare Freedom Act was passed. It had a variety of votes, but remember, we have a Democrat Senate and a Republican House, so it had to have bipartisan support to be passed, and in fact, some votes went as high as 90-3 in the House of Delegates. The discussion today in court was sort of following the lead of the federal government, which implied that the only reason for the statute was to be put in place to challenge the federal statute. And that is not the case. Judge Davis was asking, what do you do to enforce it? What else does it do? And the other things it does is it gives rights to individual Virginians to avoid compulsory health insurance from employers. We are an at-will employment state, but you may not fire people as an employer in violation of public policy. This would be one of those public policy items. Discrimination is a much more obvious one. That's constitutional level. But you can't fire someone either if they refuse to buy your mandated health insurance as an employer. So it applies well beyond just to this case. It applies to every employer in Virginia, and it benefits every citizen in Virginia. And it applies against the Commonwealth and against the local governments in the Commonwealth. So the federal government is only one point of conflict here, and I'll call all the others conflict, but they're conflict for the benefit of individual Virginians. That's the perspective there. And I think that the important point in the hearing today was that it had applications other than simply to be part of our code of laws so we could walk into court and say, hey, we're injured because you are trumping, via the Supremacy Clause, our statute. Let me address one issue here that sometimes pops up among reporters, and that is the notion that somehow what's going on here is nullification. Nullification is when a state doesn't go to court. The state simply says, we're not going to follow your law, federal government. That's nullification. That is not what Virginia is doing. As Alexander Hamilton said in 1788 in the New York Convention, Justice O'Connor quoted him in the New York case that's so important in this case. The federal courts were set up in part to referee these disputes of constitutional authority between the federal government and the state governments. That's part of why we have federal courts, and that's what it's being used for in this case. So, other hands. Julian, you being shy?
No, I have one, but I just want to make sure that
okay. Thank you.
The timing of this for a final resolution, some have suggested is perhaps June or so of 2012. Just a kind of nakedly political question, assuming that you are not someone's vice presidential pick.
Seems like a fair assumption.
Not necessarily. What impact do you think this outcome will have on the tenor and the nature of the debate in 2012?
Well, the political arena is really more about the appropriateness as a matter of policy of taking the kind of course that was taken with this piece of legislation. I think that the notion that compelling people to act is ever a good policy idea is one that we should entertain with great reservation as a nation. I mean, this is a nation founded on the notion of individual liberty, and frankly, that was an issue we had to work through even after the founding. And as I think this case shows, that debate is never really over. It will always rage forward. But this case is, you know, if they decide in the middle of the summer, if it gets appealed to the Supreme Court, they'll probably hear it in their next term, and I don't expect that ours would be the only one there. Like I said, the 6th Circuit and the 11th Circuit are going to have their cases in the court in June. And so we may see a bunch of cases land there roughly the same time. And I expect that the most likely outcome is a decision in June of 2012, and I say June because the Supreme Court traditionally decides its most challenging cases at the end of its term, and the term ends in June. So that puts it in June of 2012, most likely. There's no guarantees. It could take another term, and they could decide sooner. Theoretically, they could not take the case, but we've already seen 2 justices allude to the fact that this is the kind of case they take. So that's so unusual that it's hard to imagine them not taking the case.
But just kind of expanding on that political notion, though, I mean, you're certainly someone within your party that has achieved a great deal of notoriety, of attention. How does this factor into what's going to be a very testy campaign season?
Well, there's no question that because of the high-profile nature of this legislation, I mean, look at its impact on the 2010 elections. It was enormous. It was enormous in terms of its political impact. It remains to be seen how big an impact it'll have in 2012, but it's hard to imagine that the president, for whom this is the crowning achievement legislatively so far, wouldn't see it have a great impact one way or the other. And I actually think it's kind of hard to predict, because let's say we win entirely and the law is wiped out. Well, what's the reaction to that in the political arena? And I don't really know the answer to that. If other healthcare reform, real healthcare reform, isn't already teed up, you know, then I would expect to see the kind of assaults that you see in other areas where the charge is made, well, you just want to stop the government. No, there are positive alternatives out there. Well, if there aren't positive alternatives out there, I think you'll see one form of result. If there are positive alternatives out there, I think that that draw support across party lines, especially, you'll see it hurt the president. And I say the president because who the heck knows who the Republican is going to be? I mean, that could be anybody. So it's kind of hard to make a one-to-one comparison there. But it'll be teed up right when the fall of 2012 rolls around. So the timing is kind of extraordinary, but not of our own making. We tried for other timing. Weren't successful on that. So any other questions here in the room? On the phone, can they hear me? I think they can hear me. Yeah, talk. All right, on the phone, you all are unmuted. Who wants to go first on the phone? Nobody. Yes. Go ahead.
Actually, I have 3 questions I'd like you to address if you don't mind. One, it was a little hard hearing. I wanted to be sure that I had heard correctly that you were saying if the Commonwealth loses before this panel, you will not ask for a hearing before full court. Is that right?
That's our expectation, yes.
And then the other 2 are, I'm wondering if you could talk a little bit more in detail about Judge Motz's opinion on Comstock and how you think it relates to this case. And secondly, I'm interested in any observations you might make about shifts in the federal government's form of argument today, whether you saw them taking a different kind of emphasis on the activity-inactivity question.
Okay, first, Judge Motz wrote the appellate court opinion in Comstock, and my colleagues will correct me if my memory is wrong, but she found for what I would call the limited government side, and found that the federal government had overreached its authority in that case. The Supreme Court took the case up. It was 5-4 case. It was in which they, it was broadly worded, but then funneled through a 5-part test at the tail end of Justice Breyer's opinion. And for those of you in the courtroom today, you would have heard some discussion of some of those 5 tests. Judge Motz was very lively during the discussion, any discussion of Comstock. She was very engaged in, you know, sometimes even before one might finish answering your question, moving on to a point, a finer point. So that opinion that she wrote figured in today's argument substantially, and the fact that she was so familiar with it also factored in today. And frankly, I take heart from the fact that she came down in that opinion in the limited government position, and we'll see if she does so in this one. With respect to shifts by the federal government and how they argued or what they argued, I only have a couple of comments here. One, the Solicitor General of the United States made the comment that, let me find my notes here, that what they were arguing for on behalf of the federal government was that this legislation regulated the decision to self-insure. Now, that's an artful way to say the decision not to buy health insurance, the decision to do nothing. So that's how they're trying to sort of skirt the inactivity versus activity distinction. And you would note, and the judges noted today, that there are no Commerce Clause cases that talk about inactivity. Only activity is discussed because it has up until now always been presumed from the language of the text of the Commerce Clause itself that there was something going on that was to be regulated. And whether that was a direct economic effect or behavior that in turn had an economic effect, in the aggregate was just a degree of attenuation. But that was how they treated that. The other thing that he said of interest was that even in speaking to the court, even if you don't think there's activity here, the necessary and proper clause covers it. So the federal government took the position today that you don't need any form of activity to rule in favor of the federal government. That has never, ever happened before in the history of Commerce Clause cases. As if there was any doubt that what the federal government is asking this court to do was beyond the outer boundary of case law under the Commerce Clause to date. I think the Solicitor General made it very, very clear with that statement at the very end in rebuttal when they got up after our presentation. It was the very end of the argument. So those are the two areas where I saw either clarity or shifts, what I would call shifts, we'll see if they stick with it. They have moved around periodically as this case has gone on. Anyone else on the phone?
Just to be clear, the Supreme Court reversed on Comstock.
Yes, no, that's absolutely correct. They upheld the government action, but at the end of the opinion, they set out a 5-part test for why they did so. The prong of that 5-part test that was discussed somewhat today was that the states essentially had veto power. They could step in and take the prisoners from the federal government, and the federal government accommodated the states on that. That was the one of the 5 tests that was discussed in court today. So they did reverse her limited government position, but they then imposed a very strict test that the federal government cannot get through if in our view, in this case with this particular piece of legislation. Others on the phone? Anyone else on the phone?
Yeah, David Patton, Newsmax. I've got a question for Attorney General.
Go ahead, David.
All right. You mentioned the extraordinary timing of the way the case seems to be on track to be resolved. Obviously, you have asked to and intend to expedite the case to the degree you're able. The Supreme Court, 2 of the justices have indicated they expect to take the case. My question would be, what would you see as opportunities for the government should it decide it does not want the case to proceed along that extraordinary timetable to delay it? In other words, what might they do? What might be done to kick this down the road another year or 2? Is that a concern?
Well, first of all, what I've described is not an extraordinary timetable, it's the ordinary timetable. We had previously asked the court by our motion to expedite to put the case on what would reasonably be called an extraordinary timetable, and they declined to do that. So we're not out of bounds here in any way in terms of our time expectations. And with at least 3 cases, just counting today, in the next month, going before courts of appeals, unless the Supreme Court doesn't want to take the case, one or some of those, even if some of them go en banc, will be ready for review at the Supreme Court level during its next term, at least in that time window. Whether they take it then or delay it is something solely within their discretion, and we have no real way to know until they either accept or reject petitions for certiorari.
So to follow up then, you don't see opportunities for the Solicitor General or anybody else to delay this case going to the Supreme Court?
Well, if we were to prevail in the Fourth Circuit,